Well, in your health headlines, today is American Diabetes Association Alert Day, and it serves as a reminder for people to know their risks. Joining me now to look more at this and what you can do to prevent diabetes is Dr. Mitchell Goldman with UCSD. Hi, Dr. Goldman. Thanks for joining us.
It's great to be here.
Well, what is diabetes? And talk about the different types.
Diabetes is basically when you have an elevated blood sugar. And the problem with having an elevated blood sugar is that it can do a lot of harm to the body. It can actually destroy your kidneys and blood vessels and eyesight. And so it's not something we want to have around. There's two types of diabetes. The type 1 diabetes or juvenile diabetes occurs because our body's immune system doesn't react probably to a virus. And so these are people that get diabetes early on. But then the most common kind of diabetes, type 2 diabetes, is what occurs in about 40% of Americans. And it has a pre-diabetes which can be very significant. And what that is basically by being overweight, by not exercising, by having a sedentary lifestyle and other problems, you can as we see here, you can actually develop these risk factors for diabetes.
So this is called pre-diabetes. So we can actually see when someone is heading toward type 2 diabetes. And can that be prevented?
It absolutely can. You know, almost every Tuesday we talk about the two most important things that we can do to prevent everything from cancer to heart disease to lung disease, and it's physical activity and proper diet. And those are the two most important things we can do. You know, if you have signs of pre-diabetes, or if you've had a blood test which shows that you're pre-diabetic, and those are tests that should be gotten for almost everyone over the age of 45 and people under the age of 45 if they're already obese or sedentary, we can prevent the development of diabetes by mostly watching our weight, making sure we exercise and eat properly.
So what are the symptoms and, of course, the complications of unmanaged diabetes?
The usual symptoms that you see is that you're urinating very frequently, much more than you would think. You're very thirsty because you're urinating. And then you have unexplained weight loss. You can almost be hungry. You can have some visual changes like blurry vision, and you can feel tired. You know, things like numbing of the hands and feet can occur for a variety of reasons. But when you have any of these 10 signs, or if you have multiple signs like this, that's the reason to see your doctor, and a very simple blood test can determine whether you have pre-diabetes.
And if we don't manage it, what can happen in the end? Obviously not anything good.
No, it really isn't. The worst things that can happen are basically problems with your kidneys, problems with heart disease, and then of course the worst possible things are you can lose nerve sensation in your feet, and so you don't realize that you are maybe wearing tight shoes or whether you're getting injured, and so you can develop a sore, and that can actually lead to amputation because you have the injury associated with a decrease in your vasculature, the way your body heals. And so absolutely we don't want to get diabetes. And blindness is another bad thing that can happen. We want to prevent it. And the two most important ways to prevent it are basically exercising and diet.
Important information. Dr. Goldman, thanks so much for being with us today.
Great to be here.
All right.